While recent studies on vitamin D have attempted to dispel some long-standing myths about its overdose, it's important to approach these findings with caution. Despite claims from researchers that the risks associated with vitamin D toxicity are often overstated, the potential dangers of excessive intake remain a serious concern. The assertion that vitamin D overdose is rare and typically requires extremely high levels is somewhat misleading. While it is true that vitamin D toxicity generally occurs with doses far above the recommended daily intake, the reality is that many people unintentionally exceed these levels, especially with the growing use of supplements and fortified foods. Unlike some other vitamins, vitamin D is fat-soluble, meaning that excess amounts are stored in the body and not easily excreted. This can lead to a buildup over time, potentially causing harmful effects on the kidneys, heart, and bones. What's troubling about these studies is the tendency to downplay the dangers of vitamin D excess in the general population. With a wide array of supplements available and many individuals self-prescribing, there's a risk that people may misinterpret the research as an endorsement to take high doses of vitamin D without medical guidance. This could be especially problematic for those who take multiple supplements containing vitamin D or consume fortified foods regularly, all of which may contribute to an unintentional overdose. Additionally, while vitamin D is essential for bone health and immune function, the push to increase its intake without clear, individualized medical advice overlooks the complexity of vitamin D's effects on different people. Factors such as age, pre-existing health conditions, and individual absorption rates can all influence how the body processes vitamin D. For instance, those with kidney issues or certain hormonal disorders may be at a higher risk for complications, even at moderate doses. In these cases, blindly increasing vitamin D intake could do more harm than good. Another potential issue is the growing trend of increasing vitamin D levels for its alleged broad-spectrum benefits, such as enhanced mood or disease prevention. However, the scientific backing for some of these claims is still lacking, and there's insufficient evidence to suggest that high doses of vitamin D will significantly reduce the risk of chronic illnesses like heart disease, cancer, or autoimmune disorders. Relying too heavily on supplementation, rather than balanced nutrition or medical interventions, may lead to unrealistic expectations and neglect of other important health practices. In short, while recent research may have cleared up some misconceptions about vitamin D toxicity, it's crucial not to overlook the risks of excess intake. The fact remains that, like with any supplement, more isn't always better. People should be mindful of their vitamin D levels and, when in doubt, consult a healthcare provider before increasing their intake, especially if they have any pre-existing health conditions or are taking other medications that could interact with vitamin D. Misunderstanding the balance between deficiency and excess can lead to unintended health consequences, making moderation and professional guidance key in safely incorporating vitamin D into one's wellness routine.